Hi, this is Mona Habib with Insightful Psychiatric Mental Health. I'm a board-certified psychiatric mental health nurse practitioner with over 15 years of experience as a medication provider. I wanted to make this video to inform all of you about some of my background and training. Like I said, I've been a nurse practitioner for 15 years. I've worked strictly in psychiatry in all kinds of settings. I've worked on inpatient psychiatric units. I've worked in outpatient psychiatric offices. I've worked in hospitals, private practice, and community mental health centers. My background includes my education and training. I'm originally from Boston, Massachusetts. I am a Red Sox fan. Sorry, folks. I went to undergraduate school at University of Massachusetts in Boston, where I got my nursing degree. It was a Bachelor's of Science in Nursing. I went to graduate school at Northeastern University, where I got my Master's of Science in Psychiatric Nursing. I was very fortunate to get clinical rotations and internships at some of the best hospitals in Massachusetts, including Mass General Hospital. I did my psychiatric internship in grad school at McLean Hospital, which again is world-renowned as one of the best psychiatric hospitals in the world. I also had the fortunate experience of working with some great mentors. Early on in my career, I worked with a wonderful, wonderful psychiatrist and physician's assistant who really took me under their wing. I worked with them for about 2 to 3 years. And honestly, that felt like a mini residency for me, which I know us nurse practitioners don't typically get the opportunity to do. So I learned a lot just working with them, observing them, looking at their techniques, and how they treated patients with so much compassion, empathy, and just a lot of care. They treated everyone as an individual, and that really stuck with me throughout my career, is that everyone is a unique individual, and we need to have compassion, kindness, and empathy for everyone that comes to us for help. Later on, I was married. I had 2 sons. They're now 8 and 10. I experienced my own kind of battle with mental health with postpartum depression, which gave me kind of another view into mental health because it was very, very personal to me, and I got a better understanding of folks in similar situations as well. I worked telemedicine for a while, when my kids were really young, which I appreciated. Gave me the flexibility to kind of manage my work and my home life. Most recently, I worked at a community mental health center in Kansas, and it was a great experience. I've been very fortunate to work with really good doctors, fellow nurse practitioners, and PAs. And I think all of them have really contributed to me building my own foundation and helping me grow as a practitioner. Now we've been in Kansas for almost 9 years, and I've come to really love this community of people. It's a great place to raise a family, and I'm very happy and enthusiastic about contributing in some small way to this community with whatever skills I have. I like to think of myself as a well-seasoned, experienced psychiatric nurse practitioner, but I'm always learning and growing. I'm open to, new modalities, new treatments. If there's ever a time where my patient or myself or both of us feel as though we've kind of hit a wall and we're not making progress, I have wonderful colleagues in the area that I can refer to get a second opinion, or to just, suggest anything else that maybe I'm not thinking of. So I'm very open to collaborating. And I think really by collaborating and being open, it helps our patients get better care. I hope that helps. I hope that gives some people a better understanding of who I am. And, if I if you feel like I'm someone that you might be comfortable talking to and seeing, please visit my website, www.insightfulpmh.com. Bye-bye.